From the nation's capital in Washington, D.C., the Congressional Report, with your host, Iowa Congressman Tom Latham.
This country is based on farms, on small businesses, and creating jobs and opportunities. That is the lifeblood of this nation.
And now your host, Congressman Tom Latham.
Hello. Few functions of the government have a bigger impact on the American people than the tax code, as millions of Americans will attest every April when they file their tax returns. Unfortunately, the federal tax code has grown over the decades into a confusing maze of mandates and rules. The Ways and Means Committee is the chief tax writing committee in the U.S. House of Representatives, and the committee oversees critical revenue-related aspects of government programs. Joining me today is the Ways and Means Committee ranking Republican, Congressman Dave Camp of Michigan. And Dave, it's great to have you on the show today. A great friend, and welcome.
Well, Tom, it's great to be here. Great to be with you. Thank you.
Tell us a little bit about yourself, your district in Michigan, and about yourself personally. What's your background?
Well, I have a large rural district, more farms in my district in Michigan than any other district in the state, 15 counties, lots of small towns, very diverse agricultural base. As I said, smaller farms. My largest commodity is dairy, but lots of sugar beets, soybeans, cherries. If you've ever heard of the cherry capital of the United States, it's Traverse City, Michigan. That's also in my district. So it's a great area. I was born there and lived there my whole life, and my 3 kids are being raised there, so it's great. I kind of got into this as a volunteer when I sort of saw the needs in the community and was trying to help various community organizations and help other candidates run for office, and eventually then that sort of became my hobby, and eventually my hobby overtook what I did. So.
Actually, we're very similar in that regard, because I helped a whole lot of other people and never thought about running myself. But, well, ranking member of the Ways and Means Committee, what's that?
Well, that means I'm the lead Republican on the Ways and Means Committee, which
How large is the committee?
Well, there are 26 Democrats and 15 Republicans. Okay. And it's a committee that has a lot of what they call out here jurisdiction or authority. A lot of bills come to the committee, all tax bills. And of course, under our Constitution, all tax bills originate in the House. Mm-hmm. So the Ways and Means Committee has authority over all tax policy, Social Security, welfare, health care, Medicare particularly, and welfare reform. So a lot of issues have some sort of tax component to them, and we see them all.
And man, you're on the funding, not necessarily the policy side, but you have the ways and means to finance these programs that are out there.
Yes, and in certain other issues like Medicare and others, we have policy responsibility, right. But not appropriations as you do. We certainly don't have that responsibility. But and part of my job is to try to fashion issues and lead the other members of the committee and develop good ideas for our country, and that's really our role there.
You know, I hear a lot at home about how complex the tax code is, that it costs either weeks of effort if you try to do it yourself, or you have to spend a lot of money to have someone else do it for you. What do you think of the tax code? I mean, is it just gotten totally out of control? I know there's a lot of items in there for every different industry in the country, things like that, but what do we need to do?
Well, it really has gotten out of control. It's been at least 25 years since we've had any meaningful tax reform. It's about 10 times the size of the Bible with none of the good news. And so it has grown very complex over the years. And also the burden has become high. I mean, taxes have gone up, and in just this last year and a half, we've seen $700 billion in tax increases on the American people. And being in this deep recession that we're in, that is, with more responsibility and a larger burden on the American people, it's very hard to be productive and get people back to work and get our economy moving again. So the complexity, the lost time in terms of compliance, those are huge, and we need to find a way to make our code flatter, fairer, and simpler.
How do you do that?
Well, I think you have to do it by scrapping what we have, and really starting over and look at bringing down rates and also simplifying all the various complexities that have been added this year and that year to help one particular group or another. But I think more importantly is a fundamental philosophical change. What we're seeing in the last year and a half is that the code is being used as a credit card to pay for all these other spending programs. And so we're seeing an increasingly onerous tax burden, finding new ways to raise taxes. For example, in the health care bill, there's a tanning tax, for example. Billions of dollars being raised on that. It's a 10% tax that is a federal tax. Now, as we know, many of those tanning salons are small businesses, and they're going to have to find an entirely new way of implementing that tax. That's just one thing. But certainly the tax burden on small business, with both the individual and employer mandates under the legislation, under the healthcare legislation, are just examples of how the tax code is being used to pay for these changes in social policy. And that's probably the most difficult trend that I see going forward.
And I guess to go on with that point, you mentioned there's $700 billion of new taxes this year. Is that mostly in the health care bill, or where are all these new taxes coming?
Primarily in the health care bill. There were a whole slew of taxes also in what I call the cap and tax or cap and trade bill. That obviously has not been through the Senate, so that was just House passed. Mainly in the health care legislation.
What happens at the end of this year? What do you see? That real concern, I know. I've talked to a lot of small business people, and just on personal level, their marginal tax rates, if nothing is done before the end of the year, their marginal tax rates are going to go up. Their capital gains tax rates are going to go up. The death tax reverts back to what it was, very onerous on family businesses. What do you see happening? Well,
there's lots of problems. I mean, obviously, the snapback from all the tax relief that we've had for the last decade ends, and clearly the estate tax, which now is at zero, it looks as though they're going to pass something retroactively. Well, it's very difficult for family farms and small businesses to plan when they don't know what their responsibilities are going to be, both in individuals, because many businesses are pass-through entities. That means they are businesses, but they're organized and pay their taxes as if they're individuals. And so when you hear all the talk of, well, we'll just raise taxes on the rich people, generally meaning people with incomes over $250,000, well, a lot of that is small business income. And in fact, half of the income at those levels is small business income. And if we're ever going to recover this economy, it's going to come through the small business sector. That's where 80% of the job creation has been over the last few years. That's where we're going to need to see job creation to get things going again. And so to raise taxes on those entities is really going to make it difficult for us to come back. So certainly the marriage penalty, the child tax credit, the death tax, which has already expired, those are all things that we don't know. And then many employers come to me and say, we can't make a decision about hiring because we're trying to figure out what our responsibilities are going to be under the health care bill, and of course we're waiting for the leader of the free world, Kathleen Sebelius, to write all the rules and regulations with regard to the health care bill.
And her position is really what?
Secretary of Health and Human Services.
Right. Okay.
And so we're waiting for that to occur, and yet then there's this uncertainty about all this. And I think one of the strongest things the President could do is say, for 2 years, we are not going to raise taxes, and that will give small businesses and large an opportunity to plan and determine what they can do. But they're still going to face this uncertainty from the health care legislation.
My frustration coming from a family small business, subchapter S, there is no recognition, it seems to me, by the people who are in charge today of how they operate. I mean, you take out money to live on, but that money, the quote, the profit, stays in the business. You invested in new equipment, you hire new people, whatever, and it simply cuts down on the ability of the small business to create jobs, whether it be buying a new piece of equipment that creates a job over here, that someone that built that piece of equipment, or hiring more people in your own workforce. They just tell me what do you think the effect of the taxes are on on real people.
Well, you have really touched on it exactly in terms of what the problem is, and I think we have many people in the administration whose only background is either in academia or think tanks or government service, which those are all
There's virtually
fine.
nobody in the administration that's ever worked in the private sector.
No, not at all. And I grew up in a family business. I know how my dad struggled to make ends meet, and with the responsibility of his employees, and also the risk that he took. It was his investment. And so I know how difficult that is, and I have great admiration for people who are trying to make it every single day in their small businesses and provide for them, their families, and for others in many cases. But you're right, with this uncertainty and this idea that it's just all salary and you can simply tax that money and it's not going to have an impact on millions of decisions around the country to, as you say, buy that piece of equipment, hire that person, hire a summer job to move things along. All of those decisions get factored into what the tax burden is going to be. So it doesn't come out of thin air. It comes out of the ability, and now more than ever, we need to have the ability to invest. Now, we didn't mention that also capital gains taxes snap up as well. We have the highest investment taxes, one of the highest in the world. Those go directly at the ability for people to create the kind of economic activity that will create more jobs, and it is all about jobs. And one of the things that's happened with all of this spending is we cannot tax people enough to meet this voracious appetite for federal spending. And what we've seen is a tremendous increase in national debt. Over $13 trillion, the highest ever. And it's a hard number to get your hands around, but if you think of it this way, it's over 90% of our entire economy of the United States. We have the largest economy in the world, and our debt is 90% of the economy. Now, we've seen this preview in Greece of coming attractions. Now, Treasury last Friday announced that by 2015, that's not very far away, the debt would exceed 100% of our economy, meaning our debt would be larger than the entire economy, and that's coming. So we've had this rapid increase in debt, this increase that's going to continue, and what that means is, and we've had experts come before the Debt Commission, which I serve on, which is to study our fiscal situation in the United States. People have come and said, when the debt gets to 90% of your economy, or GDP, that causes a decline in growth of about 1% in your economy, which translates in America to about 1 million jobs. So there is a direct connection between our debt and the ability of the economy to create jobs. And that is going to make it very difficult for us to recover. I mean, we've seen unemployment stuck at 10%. Clearly, the stimulus bill did not stimulate hiring. And we have had recent job creation in the last month was flat. I mean, there were virtually no private sector jobs created in the last month. The only job creation was temporary census workers. Right. And then we've had a higher than expected this week filing in terms of claims for unemployment. So we have a lot of work to do. I think the idea that the government is going to get us out of this recession is the wrong direction. I think what we really need to look at is a stronger, more vibrant private sector. That's how we're going to create jobs in America.
You mentioned and what you're saying. I mean, we are at that tipping point right now.
Yes.
Of where it's going to have a permanent negative impact as far as the growth of our economy and reduce jobs, basically 1 million a year. That debt is $13 trillion we just surpassed here a few weeks back. The outstanding liabilities for the country are probably well over $100 trillion. Part of that, and your committee has a major role as far as Medicare and Social Security. Where are we on those two entitlements? I mean, in my mind, Social Security would be much easier to fix than probably Medicare.
Yeah.
Again, that's a much larger potential problem out there for us. Where are we?
All of the entitlements, whether it's Medicaid, which is health care for people of low income, Medicare, health care for seniors, and Social Security, are all on an unsustainable path. And part of this is the change in our population. People are getting older in America.
Are you talking about us baby boomers?
are getting close to retirement age. Okay. And there are fewer workers supporting those systems coming along. So we have an unsustainable path, and we obviously have to take a very serious look at all those. Part of that is going to be the responsibility of the Debt Commission that I mentioned. We don't report until after the election on these issues, but we have to look at finding a way to make these programs viable. I think one of the real problems with the health care bill is it expanded dramatically Medicaid, which is not on a sustainable path already. The states are not able, it's primarily a state-funded program, about half and half, it varies on the state. Medicare is an all federally funded program. So the states aren't able to sustain their burden of this program. So what they did in the health care bill is just simply wave a wand and say the federal government will pick up the state's share, but only for 4 years.
Right.
So what's going to happen after that 4-year period?
It's a huge unfunded mandate
on the states.
Yeah.
And so we've got to try to not make the problem worse, is I guess my point. And what we're seeing is continual success at making the problem worse. There was a brand new entitlement added on long-term care called the Class Act in the health care bill that even a Democrat senator called a Ponzi scheme. So it is not sustainable in terms of its ability to continue, and will mean, again, a huge unfunded liability for future generations. So we've got a lot of work to do to try to find ways, and clearly people are living longer, there are fewer workers supporting those, and so we'll have to find some creative ways to deal with that. But I think one of the things we've got to do is stop spending. We're now at 25% of our economy in terms of spending. It's gone up dramatically, and for the first time since 1974, the House has not passed a budget.
Right.
So after all of the spending that has occurred, there is no budget. And how can families, small businesses get this? You have a budget. Especially
if you're in trouble. You really have to sit down and plan and put a budget together and to understand how you get from here to the next paycheck or beyond. And there's not even an attempt to try and figure out what a budget is in government this year.
You have to establish priorities. That's what a budget does, and that isn't happening. So that, to me, is the real crime on all of this, is that after all of this run-up in spending, after the problems we've seen in terms of our debt dramatically increasing, the impact it'll have on jobs, we have no budget. And as I said, every year since 1974, the House of Representatives has passed a budget. That's where many of the appropriations bills originate, and it's just important that we do that, and I think it's very, very discouraging that that hasn't happened.
Well, and as an appropriator, we have no basis of writing the 12 appropriation bills. And, you know, the fact of the matter is that according to the President's proposed budget, to spend $3.8 trillion next year, of that we're going to borrow $1.6 trillion, or about 43 cents for every dollar the federal government spends next year is going to be borrowed money, and expecting our kids, grandchildren someday to pay that off. I mean, you're exactly right. It's not sustainable. We can't do it. And projections long term, you know, 10 years from now, we're up over, what, $20 trillion? At that point, every dime that you raise on the Ways and Means Committee as far as income taxes goes to service the debt.
Absolutely.
Only. And no services, nothing, only to pay interest on the debt.
So when people say to me, what are we going to do about our fiscal situation, I say, well, let's get a budget. And let's start there. And then you have to make those hard choices, and unfortunately, that's not being done.
Do we have to do, I mean, you're on the commission, the Deficit Reduction Commission, that's the formal title of it, but how does that operate, and who all is involved with this?
Well, this was presidentially appointed, and some of the appointments were the president's, some were our leader, John Boehner, some were the Speaker of the House, Nancy Pelosi, some were Harry Reid, the leader of the Senate, and also Mitch McConnell, the minority leader in the Senate. Some of these commissions have worked over the years, whether it's Base Closing Commission or 9/11 Commission. So I hope this one is successful, because I think the country's at a crossroads, and I believe it's very important that we try to find a way to resolve our incredibly increasing debt. But this, and most of the commissions that have been successful were even numbers of Republicans and Democrats. Regrettably, this one is 12 Democrats, 6 Republicans. I hope, though, that won't prevent us from finding common ground. And so we're meeting. We are required to report by December 1st. They're not binding. The Speaker, though, Nancy Pelosi, has said she will bring our recommendations for votes on the House floor if we can get there. A lot of this, some of the members of the commission are not members of Congress. They're from the private sector. There's union representation. And what we're trying to do is, we've been reviewing the nature of the problems and discussing alternatives, but hopefully making sure everyone gets up to the same sort of knowledge base on all these issues. And we've had very good presentations. The monthly meetings are streamed online, so anybody could go online and watch those through the White House website, because this is a presidential commission.
Have you had an opportunity to actually discuss priorities, or are you still just gathering information at this point, or where are you?
Well, we're gathering a lot of information. We have informally discussed priorities. There's certainly a lot more to do. We've only had 2 full meetings, so we're still in the early stages. But we're on a pretty short time frame. December's a lot closer than it might appear.
Going back to one of the major pieces of legislation this past year is the health care reform, and we've talked a little bit about it. But what are some of the tax provisions in that are going to affect either individuals or small businesses? Or are people actually going to be able to keep their insurance policies? What are you seeing?
Well, I think one of the concerns with the bill is that for many Americans, well, first of all, to pay for this bill, there were significant cuts to Medicare that are going to make it difficult for seniors to find physicians. And this is from the Congressional Report.
I already have physicians in my district that have put up signs, "We will no longer take new Medicare patients."
Yeah, and that is not health care reform. I mean, because what and this bill, of course, has been scored by CBO to actually raise health care expenditures and also raise premiums by about 13%. Clearly, our alternative to health care reform was the only bill that was scored that actually lowered premium costs by about $2,100. So, it was about trying to lower overall health care expenditures, which this bill does not do, and also try to lower premium costs, which this doesn't do. So, and what we're seeing is many employers are going to pay the penalty rather than be required to offer acceptable health care as defined by the federal government. So we've had several large employers come forward, and if you add up the employees and the retirees, about 2.3 million Americans have already been sort of considered to lose their health care because the company's going to just simply pay the penalty. And certainly many small businesses are making that calculation. Probably the biggest problem is this requirement that everyone buy insurance, and if you don't, you pay a tax. Now, they did not apply that to illegal immigrants. If an illegal immigrant shows up at an ER and they get tracked for using health care and don't have a policy, there will be no penalty. But if an American shows up at an ER and they track you don't have health care, you will be required to pay a penalty. And the IRS is going to be enforcing these provisions of the health care bill, and it's estimated they'll have to hire as many as 16,000 new agents to track
16,000 new IRS agents
to track whether people are complying with health care. Now, the other onerous part for small businesses is that small businesses are required to send a 1099 now for any expenditure over $600. So, for example, if you're in a small business and you've gone to 2 times a year to your annual convention, and that you'll have to you fly there, you'll have to send a 1099 to Delta Airlines. Or if your hotel, Marriott, ends up being more than $600, say you stayed a week at this convention, that would be another 1099 to the Marriott Corporation. So the burden on small business to ship out these 1099s all over the countryside. And it could be, for example, if they use more than $600 of postage during the year, there would be a 1099 going to the Postal Service.
Is this just for businesses or for individuals?
This will be small, just for business, for employers.
Only.
Yeah, individuals won't have to do that with their personal, but a small business will have to. So that's the big concern with the burden. And of course, a lot of the bill is yet undefined because the regulations are being written, and it is not going to be implemented all at once. This is over many years, and so as time goes on, we're going to have to continue to keep up with what it is.
But don't the revenue provisions that came out of your section of the bill started immediately, but the coverage doesn't really kick in for 4 years? Is that right?
Yes, the responsibilities and the taxes are right away, and the actual benefits from the bill are for 4 years. Now there are some
4 years from now.
Some are going to be this fall. The pre-existing, they're actually not pre-existing condition, but the actual high-risk pools will start in September. That's really the first part of the bill, meaning that if you have a pre-existing condition, you'll be eligible to get insurance from a high-risk pool.
It's just mind-boggling to me in the small business where you have a lot of reports you have to do anyway and a lot of compliance, and it's very difficult because you're in the grocery business or whatever. You're not someone who wants to send out 1099s to the local store next door because you bought your supplies from them or something.
You're trying to do your job, and you're trying to do the mission of whatever the small business is, whether it's delivering a service or, as you said, having a grocery store. And here their job is going to be compliance with federal regulations.
Right, yeah. Well, what about the idea of, and you mentioned someone that they'll get sick, they find out they don't have a policy, and then fine them. Isn't there a perverse incentive to wait and not buy a policy, and then if you get sick, because you're guaranteed issuance, so you wait until you get sick, then you finally buy a policy? And they're talking about ambulances stopping by the insurance office on the way to the emergency room to buy a policy. Is there a perverse? They
do have guaranteed issues, so yes, you'll be able to wait until you're sick and buy the policy under this law. You will be able to do that. I think that's something that could happen, very much so.
And that undermines the whole idea of insurance as far as people all being in the pool to begin with.
Well, insurance is and what we needed to do is incentivize people to buy insurance and health care. There are ways you could have done that. For example, there's been a lot of growth in health savings accounts, a lot of growth in tax-free saving to be used for health care. Under this law, what they've said is you can no longer use those accounts to buy over-the-counter medication, which is a less expensive alternative than going to the doctor and getting a prescription. Well, they're not going to allow that use, and so all of the reforms that have been tried to be pushed, which is have people responsible for their health care, have them consider maybe a less expensive alternative, don't show up at the ER if there's an over-the-counter medication that might take care of your problem. Well, that's now not going to be able to be eligible for these pre-tax funds, and that's going to affect about 50 million people in the United States who use some form of tax-free savings or health savings account. We've also seen a 25% growth in health savings accounts, so people clearly are moving into this kind of model, and this bill is unclear whether those will be acceptable health care coverage according to the federal government.
Okay. We're out of time.
All right,
thank you so much. I really appreciate you coming with me today. The Internal Revenue Code is too complex and burdensome for American families and small businesses. A simpler tax code would mean fewer headaches for the American people while helping businesses create new jobs and investment in our communities. I'd like to thank my guest, Congressman Dave Camp, for his insight into these critical topics, and I hope you'll join me next time on the Congressional Report.
From the nation's capital in Washington, D.C., this has been the Congressional Report with Iowa Congressman Tom Latham. Have a question, comment, or concern? Congressman Latham wants to hear from you.